The following presentation outlines the proposal of Stephanie Blair, Kristen Borkin, Heidi Borowski, and Amy McCarthy to research the efficacy of wound vacuum-assisted therapy compared to that of conventional dressings on non-infected surgical wounds. We propose to study, in adults with wounds, how does vacuum-assisted wound closure compared to conventional wound dressings affect healing within 8 weeks. The purpose of the study is to evaluate the course of wound healing while using wound vacuum-assisted therapy and compare that to conventional wound dressings. Find evidence that supports use of wound vacuums over conventional wound dressings to justify the use of one method over the other to promote better outcomes, cost effectiveness, better patient care, and influence nursing care practice. This is a prospective cohort quantitative research study which measures amount of wound healing in centimeters using the Medline Bullseye Wound Measurement Tool to evaluate which treatment method results in faster healing as defined by the patient group with the greatest decrease in wound size over 8 weeks, using a 2-sample t-test to determine whether the means of the two groups are statistically significantly different at an alpha level of 0.05. Additionally, we will be able to find measures of association such as risk ratio or odds ratio for various negative outcomes associated with form of treatment over the 60-day period to further support our theory of improved healing from wound vacuum therapy over conventional dressing. The study would be done in a clinical setting with patients already requiring treatment for surgical wounds. Patients would not be inconvenienced by the study setting because they would already be there for clinical follow-up. Lowering the attrition rate, providing greater amounts of data, clinical professionals are needed to assess the progress in a controlled setting. Included in the study are individuals between the ages of 18 and 60 years old, requiring treatment for surgical wounds who are otherwise healthy, and non-smokers are the subjects of this study. Exclusions to the study are those under 18 or over 60 years old, individuals with non-surgical wounds, smokers, those with diabetes, compromised immune systems, or on anticoagulant therapy. This study will use a convenient sample population of 100 patients in a clinical setting needing wound care, half receiving wound vacuum therapy and the other half receiving conventional dressing. The wounds will be measured in centimeters over 8 weeks during dressing change. Progress will be documented on a weekly basis, and data will be collected and kept in a secure area at the medical facility. The problem we are studying is the time it takes for surgical wounds to heal. The longer it takes a wound to fully close and heal, the longer the protective barrier of skin is broken, promoting the possibility of infection by leaving a portal of entry accessible to microorganisms. The purpose of this study is to evaluate the course of wound healing while using wound vacuum-assisted therapy compared to conventional wound dressings. Risks involved with extended healing time include incomplete healing, infection, local and systemic, repeat surgery, pain, amputation, death, and scarring. The problem we are studying is the time it takes for surgical wounds to heal. The longer it takes a wound to fully close and heal, the longer the protective barrier of skin is broken, promoting the possibility of infection by leaving a portal of entry accessible to microorganisms. The purpose of the study is to evaluate the course of wound healing while using wound vacuum-assisted therapy and compare that to conventional wound dressings. Risks involved with extended healing time are incomplete healing, infection, both local and systemic, repeat surgery, pain, amputation, possible death, and scarring. Additionally, finding evidence that supports use of wound vacuums or conventional wound dressings could be used to justify one method over the other, promoting faster healing and better outcomes, promote cost effectiveness, impacting patient care, and determine the care the nurse is providing. There is a need for change in the present practice because of the risks involved with surgical wounds that could possibly be lessened if the study revealed that wound vacuum-assisted closure is more effective at promoting healing. This study hopes to decrease healing time through wound vacuum treatment. The purpose is to evaluate the course of wound healing while using wound vacuum therapy and compare that to conventional dressings. The findings, if positive for wound vacuum use, will justify their use during treatment, promote better outcomes, improve cost effectiveness, lessen pain, scarring, and healing time, morbidity, and mortality associated with open wounds. Why change? There's a cost to wound care, and there's an even larger cost to improper wound care. This study will impact patient care and nursing practice based on their treatment and outcomes of their treatment. Determining which form of treatment is more effective will provide better patient outcomes and promote cost effectiveness. A literature search for appropriate information on the subject of wound healing and use of wound vacuum-assisted closure was performed. The search looked at the following databases: CINAHL, PubMed, National Guidelines Clearinghouse, NIH, and CDC sites. Keywords used to find these sources included wound, incision, surgical incision, wound vacuum, bandage, dressing, conventional dressing, moist dressing, infection control, healing, healing time, and wound vacuum versus conventional dressing. 5 articles were found relating to wound healing and the use of wound vacuums and conventional dressings. After reviewing these studies, we have found a consistency revealing the efficacy of wound vacuum-assisted therapy when compared to conventional dressings. There are gaps in the studies, as none were specifically performed on surgical wounds that are not infected as an initial treatment. Article number 1 is a report from ProQuest in 2013, where the effectiveness of wound vacuum-assisted closure on diabetic foot ulcers was studied in a qualitative research study, revealing vacuum-assisted closure to be suitable, safe, and more effective treatment mode than moist coverings for the management of foot ulcers. The use of the Wagner scale and Mann-Whitney test were employed for comparison of healing. All subjects in this study were satisfied with the results from the vacuum-assisted therapy, compared to 23.1% satisfaction rate for the moist dressing group. Our study will further evaluate the efficacy of wound vacuum-assisted treatment when used for surgical wounds over an 8-week period on non-diabetic patients. The second article is based on a quantitative study comparing vacuum-assisted closure to moist wound dressings in the management of open wounds in a randomized controlled trial in 2016. The purpose of this study was to identify the best dressing technique for wound management. In this study, there were 278 people included. They were split into 2 equal groups. Group A was composed of VAC therapy patients. Group B was receiving moist wound dressings. The VAC therapy patients had a dressing change every 48 hours, whereas the moist wound dressings were changed every day. The study provided the basic demographics of the patient's age, sex, and wound size. The results were measured using the chi-square test and measuring the size of the wound. The study was done over the course of 4 weeks. It showed Group A had significantly more wound healing than Group B. Group A, VAC therapy patients, showed 45.3% reduction in size of wound, whereas Group B showed only a 29.5% reduction in the size of the wound. The third article is about the benefits of using the vacuum in surgical and chronic wounds. Many people who encounter these types of wounds are at risk for loss of a limb or even death. It is important for the healthcare field to understand which options are suitable for each patient. The advantages stated in the article included faster wound healing, wound approximation, and also lower wound-related treatment costs and improved quality of life during treatment. There is a notably lower cost in treatment due to the less hospital needs due to the wound vac. The study that was done explored the VAC therapy in vascular surgery results compared to conventional methods. It was also done to test the cost differences in a country like Serbia. The study consisted of patients from January 2011 to January 2012. There were a total of 2,154 patients that were operated on. Out of those patients, 42 of them had complicated wounds and were treated with the VAC. The results were compared with those who had conventional methods of treatment. The patients in the study were all divided up into groups depending on where the wound was and if they had an amputation. The point of the study was to see when the endpoint of the study was and also the duration of the hospital stay. Out of the 80 patients, there were 42 that ended up being treated with the VAC and 38 that were treated by conventional methods. The study shows that the benefits of VAC therapy in comparison to everyday dressings of chronic wounds. The conclusion of the study stated that vacuum-assisted is much more effective when it comes to treating complicated wounds. It has been proved to be cost-effective and also a first choice for those with superficial infections. Zamir and others in 2015 presented a comparative study between 2 methods of wound treatment, The condition of a wound bed is crucial for healing. The methods involved are vac therapy and traditional saline wet dressings. The saline wet dressings have been proven difficult to remain moist to maintain the healing environment. The study uses a low-cost, custom-made vac therapy to better serve the low socioeconomic patients involved in the Kashmir Valley. The vac is consisted of negative pressure applied to the wound, which allows for blood, serous fluid, and bacteria to evacuate through a closed system. This allows for a hypoxic environment and reduces infection rates. The results are undeniably certain that vac therapy is a better approach to the specific wounds described. A total of 60 patients of lower socioeconomic status were studied. Ages ranged between 40 to 70. Without any reason, the 60 patients were split into two groups. The wounds included are diabetic foot ulcers, traumatic ulcers, fasciotomy wounds. Excluded wounds included malignancy, exposed arteries or veins, patients on anticoagulants, patients on immunosuppressive agents, and those who had previously used a vacuum therapy. The study was completed over a year with close monitoring for all patients involved. After discharge, follow-up visits were made to monitor wound healing. Patients who were lucky enough to have vac-assisted therapy had fantastic results. The dressing was changed every 48 to 72 hours unless the wound was infected. The amount of granulation tissue at the end of the study was 100% for the custom-made wound vacuum. The amount of granulation tissue found in the sterile wet dressings is 63%. These results were measured at the end of the study for each patient, which was 7 weeks. Patient satisfaction was exceptional related to the vac therapy, with no reports of discomfort. Both groups had protein-rich diets as per hospital policy. There have been similar studies completed to show the effectiveness of wound vac. In conclusion, this is another research study done to prove vac-assisted wound technology healing time beats saline wet dressings when it comes to the wound bed and healing time. Walma and others in 2016 looked at the efficacy of wound management in patients with infected wounds as a post-perineal surgery complication. This study has showed that vacuum therapy is often used after traditional medical surgical debridement, draining, and conventional dressings were ineffective. The study did not have two comparable groups as the vacuum therapy was used on the worst patients. Similar results were found in the two groups for healing time. However, the vacuum was used on the worst patients who were not healing prior to vacuum use. Therefore, one could guess that vacuum therapy will outperform traditional dressings, but this needs further study. These test results were inconclusive. There is a gap in knowledge that needs to be addressed. Our study aims to show healing promptly from surgical wounds within 8 weeks of surgery, thereby lessening the likelihood of long healing time that is complicated by infection. The treatment of surgical wounds is significant to nursing. Nurses are the ones to care for patients post-surgery and monitor wound healing. Nurses need to use evidence-based practice to provide appropriate care. The results of our study hope to show that wound vacuum-assisted therapy speeds healing time. This will lessen the likelihood of infection, allowing patients better outcomes. The goal of nurses is to provide the best care for clients. This study will provide a sound basis for furthering the practice of appropriate post-surgical incision care. Based on the literature review on this topic, the need for further study is indicated. This study will impact the healthcare, in particular nursing. There is a large number of people requiring treatment for wounds in the clinical setting. Oftentimes, patients receive one form of wound therapy when they may benefit from another. Often the mode of treatment is chosen based on the physician preference or, as one study suggested, gut feeling. Studies have been done on efficacy of wound vacuum-assisted therapy compared to traditional therapy. Evidence-based practice is the best way to treat patients effectively. Studies have been done showing the healing benefits of wound vacuum-assisted technology on diabetic foot ulcers, infected perineal wounds, etc. This study will add to the body of medical surgical knowledge from which nurses and other medical professionals can draw information on proven forms of wound therapy. Further studies and statistics on which form of treatment is more effective, wound vacuum versus conventional dressing, would provide better patient outcomes. Additionally, the study's findings would promote cost effectiveness, which benefits those paying out of pocket for care and the medical facilities providing treatment. When an infection is hospital acquired, insurance does not cover the cost of treatment. Therefore, preventing infections by providing optimal care immediately after surgery will lower the hospital overhead by preventing many post-surgical incision infections. The time it takes for wounds of other types to heal has been shown to be reduced in studies of other wound types. Reducing healing time will lower length of hospital stays, prevent costly infections, and reduce medication costs to treat infections and those for pain relief. Nurses will benefit directly from the advanced wound care knowledge as they can use the findings to improve the evidence-based practice care they provide for their patients on a daily basis. This will lead to optimal outcomes for the patients under nursing care. This is a prospective cohort quantitative research study of 100 patients which measures the amount of wound healing in centimeters using the Medline Bullseye Wound Measurement Tool to evaluate which treatment method results in faster healing as defined by the patient group with the greatest decrease in wound size over 8 weeks, using a 2-sample t-test to determine whether the means of the two groups are statistically significantly different at an alpha level of 0.05. Additionally, we would be able to find measures of association, such as risk ratio or odds ratio, for various negative outcomes associated with form of treatment over the 60-day period to further support our theory of improved healing from wound vacuum therapy over conventional dressing. The location would be the clinical setting with patients already needing treatment for non-infected surgical wounds. Patients would not be inconvenienced by the study setting because they would already be there for clinical follow-up, lowering the attrition rate, providing greater amounts of data. Clinical professionals are needed to assess the progress in a controlled setting. Those included in the study are individuals between the ages of 18 and 60 years old, requiring treatment for surgical wounds who are otherwise healthy. Non-smokers are the subjects of this study. Exclusions to the study are those under 18 years, over 60 years old, individuals with non-surgical wounds, smokers, diabetics, those taking anticoagulant medication, and clients with compromised immune systems, such as those being treated with chemotherapy. We propose a change, a new protocol for surgical wound treatment with wound vacuums, no longer using traditional dressings. The resources needed are a location, which would be the clinic for patients, space to store data. We need patients. We need an evaluation tool, which is going to be the Medline Bullseye tool, forms to record the data upon, statistical analysis services, or a program. The implementation process includes finding patients from surgeons, explaining the options to the patients, receiving informed consent, applying the wound vac. Outcomes will be measured on a weekly basis, the data would be recorded, statistical analysis would be applied, and information would be published and shared. Implementation and evaluation is best in a controlled clinical setting. Implementation through patient and nursing compliance, patients fully informed of options for wound care, patients providing signed consent. We need continued patient consent throughout the study. We need to teach the nurse how to use the wound vac, how to use the measurement tool, how to obtain consent on forms, where to record and store data. We need a set standard application of wound vacuum, a set standard of Medline Bullseye tool use, and a set standard for data collection, recording, and storage. How to integrate and maintain the change, provide evidence to support the change, suggest the change in practice to surgeons and physicians, nurses and nurse administrators, hospital administration, the wound care team, patients, insurance companies, discharge planners, and social workers, home care associations, and nursing and medical schools. Further, to integrate and maintain this change, we need to communicate the change to the stakeholders, provide written documentation of the study results, provide electronic copy of the study, have a seminar, we could have in-service teaching, outreach to insurance companies, boards of directors, and have the results of the study published in academic journals. To integrate into practice, we need to introduce the results to the hospital administration, propose change in protocol, have a new protocol written for wound care, monitor the process and outcomes, perform a retrospective study after the implementation, follow up at regular yearly intervals, promote continued education of the doctors and nurses, and all other stakeholders. This study will validate the efficacy of wound vacuum-assisted closure, provide study information to stakeholders, promote further education on wound vacuum usage. The study will impact the healthcare, in particular nursing. There's a large number of people requiring treatment for wounds in the clinical setting. Oftentimes, patients receive one form of wound therapy when they may benefit from another. Often, the mode of treatment chosen is based on physician preference, or as one study suggested, gut feeling. Studies have been done on efficacy of wound vacuum-assisted therapy compared to traditional therapy. Evidence-based practice is the best way to treat patients effectively. Studies have been done showing the healing benefits of wound vacuum-assisted technology on diabetic foot ulcers, infected perineal wounds, etc. This study will add to the body of medical surgical knowledge from which nurses and other medical professionals can draw information on proven forms of wound therapy. Further studies and statistics on which form of treatment is more effective, wound vacuum versus conventional dressings, would provide better patient outcomes. Additionally, the study's findings would promote cost effectiveness, which benefits those paying out of pocket for care and the medical facilities providing treatment, as well as the insurance companies. When an infection is hospital acquired, insurance does not cover the cost of treatment. Therefore, preventing infections by providing optimal care immediately after surgery will lower the hospital overhead by preventing many post-surgical incision infections. The time it takes for wounds of other types to heal has been shown to be reduced in studies of other wound types. Reducing healing time will lower length of hospital stays, prevent costly infections, and reduce medication costs to treat infections and those for pain relief. Nurses will benefit directly from this advance in wound care knowledge, as they can use the findings to improve the evidence-based practice care they provide for their patients on a daily basis. This will lead to optimal outcomes for patients under nursing care. This study will validate the efficacy of wound vacuum-assisted closure, provide study information to stakeholders, promote further education on wound vacuum usage. Additionally, we will be able to find measures of association, such as risk ratio or odds ratio, for various negative outcomes associated with form of treatment over the 60-day period to further support our theory of improved healing from wound vacuum therapy over conventional dressing. This study will impact healthcare, how nurses will treat post-surgical patients. Past studies revealed efficacy of wound vacuum-assisted therapy compared to traditional dressings. Evidence-based practice is the best way to treat patients effectively. Studies have been done showing the healing benefits of wound vacuum-assisted technology on diabetic foot ulcers, infected perineal wounds, etc. Further studies and statistics on which form of treatment is more effective, wound vacuum versus conventional dressing, would provide better patient outcomes, promote cost effectiveness, lessen pain, medication, scarring and healing time, morbidity, and mortality associated with open wounds. Results of this study will impact nursing care, providing nurses with evidence-based practice for surgical wound treatment, allowing them to provide the best possible care to their patients on a daily basis.